Thank Yuli and Innovator MD for having me this evening. I'm going to talk about Healent. It's a virtual care delivery platform for orthopedics and beyond. So just by way of introduction, my name is Ben Schwartz. I'm a private practice orthopedic surgeon outside of Boston. I specialize in joint replacements. I do some mentorship work with Matter, Plug and Play Tech Center and Mass Challenge. I serve on the medical advisory board for Bowie Health, and I just completed a Doximity OpMed fellowship this past year. And I'm the Chief Innovation Officer for Healent. So we're all well aware of this healthcare Black Swan event that's going on right now. For those of you that aren't familiar, a Black Swan event is an unanticipated, unprecedented event that really causes massive disruption. So if you look at this graph of healthcare expenditures from January of 1960 through 2020, you can see at the end of 2020 here, at the end of the graph, that healthcare expenditures really fell off a cliff. There was a 40% revenue reduction in April of 2020 related to coronavirus. And so this has really changed the way that we're delivering healthcare, not only in the short term, but it's expected to have long-term effects as well, really accelerate the adoption of healthcare technology. There's a second event that's going on that really started before the pandemic. I call this the orthopedic anti-swan, and I call it the anti-swan because if a Black Swan event is completely unanticipated, this orthopedic anti-swan we've seen coming for a long time, and it's the projected future demand for hip and knee replacements as arthritis becomes more prevalent in the population. So if you look at this chart from the American College of Rheumatology, over the next 10 years, from 2020 to 2030, the rate of joint replacements is expected to grow over 200%, particularly with knee replacements, as you see from the graph. So we have these two events. We have the pandemic that's changing the way that we deliver healthcare. We have an epidemic of orthopedic conditions. And those two things are sort of converging at this point in time. So the problem as we see it is that we have to adjust. Patients and the healthcare system have to adjust to this increasing demand for orthopedic care and also the changes caused by the pandemic. But we don't feel that orthopedic providers have the best technological tools to do this safely and in a cost-effective and patient-centered manner. The solution as we see it is to automate, empower, and support. So we're automating access to care through self-triage, through virtual visits, through automated screenings. We're able to provide patient-specific educational material that is delivered directly to the patient through our app. We're empowering patients. We're giving them self-care resources to manage their musculoskeletal health, both around surgery and non-surgically. We're giving them interactive health maintenance and optimization tools to help manage their blood pressure, blood sugar, and weight to get prepared for potential surgery. And we're giving them convenient access to their care team. We also want to support providers by allowing them to leverage technology to improve process efficiency, to help them guide patients through the process really from start to finish when it comes to their musculoskeletal health, and prove to doctors and patients that digital health doesn't have to be a four-letter word. If there's a silver lining to the pandemic, it's that skeptics of healthcare technology are now seeing that this can help us deliver care better. This is Healent. Our mission is to deliver best-in-class virtual orthopedic care to improve efficiency, outcomes, and value when it comes to the treatment of musculoskeletal conditions and to empower patients throughout their entire arthritis care journey. So this is a sample of what our platform provides. On the left-hand side, this is our Your Health section. We give patients tools to manage their nutrition and do meal planning. We can track their physical activity. We can help them manage their weight and cope with anxiety around their musculoskeletal conditions and surgery. In the middle is an example. We've worked closely with our own physical therapists to develop videos within the app, so physical therapy that patients can do virtually in the app, specific to their disease condition. We have on the right-hand side our bots. So this is one of our bots. We call them Healy. There's a lot of different bots within the app. This is around pain. So there's a pain diary. The patient in this case has entered a pain score of 8. Their average score has been 7. The bot picks up on the fact that their average score was 7. It knows their pain has increased, and it gives them tools virtually to help manage their pain. We have a bot around postoperative swelling. We have a bot to help them lose weight. We have a bot to help them manage their behavior and anxiety as part of the app. And then this is how we really support the care journey. So on the far left-hand side, this is a patient that's been seen in the office. They're onboarded. They're non-surgically managing their arthritis. We're giving them information on how to do that. We're giving them tools to help manage their pain through a pain diary and the pain bots. We're helping them manage their healthcare conditions. We're allowing them to connect to their healthcare team and other patients that have similar conditions. And we're giving them the capability to do virtual physical therapy through the app. In the middle, this is a patient that now has signed up for surgery. So they've put in a surgical date, they've put in their planned surgery. The app now automatically changes the content to put them in the preoperative phase. So the appearance of the app and the interaction stays constant for the patient. It looks very similar, but now the information has changed. So they get information on how to prepare themselves for surgery. There's a calendar that helps them manage their appointments around surgery. There's a COVID self-assessment that they can do within the app. And then if you look on the far right-hand side, the app automatically knows the surgical date is passed. And so now it enters into the post-operative phase. It's been 2 days since their surgery. Now they're going to get information about their post-operative recovery. There's a Today tab. Every day they're going to get information on what they should be expecting. It's guiding them through taking their medications, doing their breathing exercises. They can connect with their care team if they need to send a picture of their wound, or if they need a telehealth visit, they can do that through the app. We're giving them self-directed physical therapy through the physical activity tab that's specific to their recovery and their condition, and we're helping them manage post-operative pain. So really, the app is guiding them throughout the process from non-surgical care through the post-operative experience. We believe this helps us deliver a safe and efficient process around musculoskeletal care. So in the past, or currently without Healent, there's a lot of manual phone calls by a nurse or somebody within the office. The patient has to go to the hospital for surgery education. They go to a joint class. They have to go to the office for post-operative follow-up visits. They may have somebody coming into the house to do physical therapy with them, or they may have to go to a location to do physical therapy. And there's really limited ability to optimize a patient's health before surgery. So somebody comes in to see me, they need to lose weight, they need to manage their diabetes, they need to stop smoking. I tell them to do all those things and come back to me when they're ready. And there's not a great way to manage that or track that, or we don't give them the tools to do that. We feel this leads to inconvenient and high risk exposure by all this in-person contact. With Healent, we can now automate progress updates. We can push information directly to the patient rather than phone calls back and forth. We can give them through the app virtual surgery education, and we can do virtual follow-up visits. So we reduce the need for in-person touches. The patient can do self-directed physical therapy through the app. We know now there's evidence in the orthopedic literature that patients that do self-directed physical therapy can do just as well as patients that do in-person physical therapy. And finally, we're giving them the tools to optimize their health before surgery, and we can actually track them as they're progressing through their optimization. So even though a lot of it's being done virtually, there's a lot more touch points than they would have under the old system. So our traction, we went through an optimization proof of concept in 2019. Average patient satisfaction was 4.5 out of 5. Patients spent about 9.5 minutes on average per session, and they lost about 3 pounds on average per week. We have since moved on to rolling out our comprehensive arthritis care platform. We're in deep discussions with 2 hospitals here in Massachusetts, where I am, and in one large Illinois health system, which is doing a security review of the product. We feel like we're uniquely positioned. So if you look at the different aspects of virtual care delivery, there's workflow automation, there's patient engagement and remote patient monitoring, there's clinical decision support, and there's patient outcomes. And we feel that our platform exists at the crossroad of all these different aspects of virtual care delivery, which positions us uniquely compared to some of the other companies within this market. Our revenue model, we have 3 target customers. One is the private practice surgeon through a monthly subscription model. They can white label the product and do an EMR integration. Hospitals and health systems can do this on a volume-based annual license or a per case basis. They can also white label and do an EMR integration. And we feel like with the shift towards outpatient surgeries to the surgery center setting, because it's safer, because it's lower cost, that we have a value proposition to surgery centers as well. And that would be, again, through a volume-based annual license or per case basis. Our team, Anup Adya is our founder and CEO. He's from the Chicago Booth School of Business. Oleg Konko and Mikhail Makovenko are our UX architect and software developer. William Wood's our marketing person. I feel like as somebody that exists in the digital health world and is a practicing physician, it's very important to have a good team of experts, particularly clinicians, Lal Puri is one of our co-founders. He's also an orthopedic surgeon. There's myself. Jenna Duffy is a behavioral scientist, PhD, and she's really helped us design some of the behavioral interventions within the app, really through the mind-body connection. Adam Bennett is our chief medical officer. Paul Durbin's a serial entrepreneur and general counsel for Gentian Capital. And Thomas Deenan is a senior vice president for Willis Tower Watson. Our future roadmap, so in the short term, we're looking to raise $1 million in seed capital that gives us runway through the second quarter of 2021. This will be in the form of convertible or safe notes. We're looking to build out our team, particularly when it comes to sales and marketing, because we feel our product is fairly mature. In the third quarter of 2020, we would look to do a seed round. We look to fully launch our joint replacement product and close 2 paid contracts in the fourth quarter of 2020, do a full commercial launch in the first quarter of 2021, and a Series A in the second quarter of 2021. Looking long term, we feel like we've really built a framework that can apply to any aspect of virtual healthcare, whether it's spine and upper extremity in the musculoskeletal world, bariatric surgery, general surgery, OBGYN. We feel like our platform can be applied to all these different specialties. And then down the road, we plan to add virtual urgent care capability, the ability to collect more robust data through wearables, and do deeper EMR integration. So in conclusion, as we all know, the expectation is that digital medicine is going to grow exponentially. We feel like we're perfectly positioned to propel physicians, health systems, and patients into this new era of virtual care. And I want to just finish with this last slide. These on the left-hand side are all the aspects of virtual care delivery. We feel like we're a comprehensive solution. EMR can deliver part of this. Telehealth and EMR can deliver part of this. We feel like we can develop and deliver on all these different aspects of virtual care delivery. So this is our contact information, I think. Thank you for allowing me to speak, and I'm happy to answer any questions.